Hello everyone and welcome back. So we have started the preparation for medicine talks and we have discussed the important instruments and the important drugs. In this part of the video we are going to discuss the medicine important pictures along with the scenario. In the medicine talks some pictures are given to us and the questions related to that pictures are asked, that is what is the diagnosis, what are the differential diagnosis, what are the investigations, what are the complications, etc. So the important cases or pictures that are common in the medicine talks are of acromegaly and Cushing syndrome, hypothyroidism, exophthalmos, rheumatoid arthritis, SLE, facial palsy, tensilin test, gynecomastia, herpes labialis, synthelasma, myasthenia gravis, exophthalmos and koilonychia. Then ptosis, acanthosis nigricans, acromegaly, hypothyroidism, diabetic foot, Parkinson's, Bell's palsy, trigeminal neuralgia or Bell's palsy, cretinism, iron deficiency anemia, xanthomata, congenital hypothyroidism. Then endemic goiter, macroglossia, myxedema, xanthomata, and juvenile rheumatoid arthritis. Then myxedema, L-thyroxine deficiency, solid edema, and spider nevi. These are the most important cases in the field of medicine. So we are going to discuss these one by one. Okay. So starting from our first picture, that is this one. Okay. So this is a picture of acromegaly. Okay, so these are the questions and answers related to the case. The question is that observe the picture and give most likely diagnosis. So what is this? This is acromegaly. What are the causes of these conditions? So these are pituitary adenoma, pancreatic islet cell tumor, bronchial arytenoid, small cell carcinoma lung, and pheochromocytoma. Then what are the clinical features of these conditions? So these are skeletal features, which are large spread like hands and feet, prominent supraorbital ridges, enlargement of the lower jaw, visceromegaly, and gigantism. In the soft tissues, these are macroglossia, thickened lips and nose, hypertension, diabetes mellitus, and metabolic are hypertension and diabetes mellitus. Now, what are the investigations that are done for the case of acromegaly? So these are growth hormone level during glucose tolerance test, fasting serum prolactin, serum IGF-1, X-ray skull, CT scan, and MRI. The treatment options for acromegaly are surgical, which is endoscopic transsphenoidal surgery or transfrontal surgery, and the medical treatment is somatostatin analogs, for example, octreotide and lenalidomide. Dopamine agonists, for example, bromocriptine, and gonadotrophic hormone antagonists, for example, pegvisomant. Others are radiotherapy. So these are the acromegaly question and answers. What is the diagnosis? What are the causes? What are the clinical features? What are the investigations? And what are the treatment options for acromegaly? This is the second picture, which is of Cushing syndrome. And the question is that observe the picture and identify the condition. So this is Cushing syndrome. What are the causes of this condition? So these are iatrogenic due to chronic glucocorticoid therapy, pituitary adenoma secreting adrenocorticotrophic hormone, adrenal hyperplasia, adrenal carcinoma, adrenocorticotrophic therapy, hormone therapy, and pseudo Cushing syndrome due to alcohol excess, obesity, and major depression. These are the causes. Now, what could be the symptoms of the patient? So these are weight gain. Symptoms are weight gain, muscle weakness, backache, excessive hair growth, menstrual irregularities, impotency, depression, and psychosis. These are the symptoms. Now write down the classical signs of these conditions. So the signs are central obesity, plethora, purple stria on abdomen, arms, etc., and proximal myopathy, hirsutism, depression, or psychosis. Now, what are the how you will confirm the diagnosis and what is the management condition? So for the confirmation of the diagnosis, overnight low load exam with S1 suppression test is done. 24 or urinary free cortisol is collected. 48 or low dose dexamethasone test and circadian plasma levels of cortisol are checked. The management of Cushing syndrome is that transphenodal surgery is done, bilateral laparoscopic adrenalectomy is done, radiotherapy is done, and ketoconazole is given. For adrenal tumors, the resection of the tumor is done, and metoten, ketoconazole, and metirapone is given. For ectopic producing tumors, resection is done, radiotherapy, chemotherapy, bilateral adrenalectomy, and octreotide. These are done. Okay. So we have discussed this is the Cushing syndrome, and the causes are iatrogenic due to chronic glucocorticoid therapy, pituitary adenoma, adrenal hyperplasia, adrenal carcinoma, adrenocorticotropic hormone therapy, and pseudo-Cushing syndrome due to alcohol excess, obesity, and major depression. The symptoms are weight gain, muscle weakness, backache, excessive hair growth, menstrual irregularities, impotency, and depression or psychosis. The signs are central obesity, plethora, purple strain on the abdomen, and proximal myopathy, hirsutism, and depression. The diagnosis can be done by overnight low dose dexamethasone suppression test and 24-hour urinary-free cortisol and 48 or low dose dexamethasone test and circadian plasma levels of the cortisol. The management options for Cushing disease are transphenodal surgery, bilateral laparoscopic adrenalectomy, radiotherapy, and ketoconazole. For adrenal tumors, the resection of tumors is done. For metoten, ketoconazole, metirapone, and for ectopic ACT-producing tumors, resection, radiotherapy, chemotherapy, and bilateral adrenalectomy and octreotide is done. Okay, now coming towards the third case, that is hypothyroidism. Here, the questions are that observe the condition and identify the condition. What are the causes? What would be the possible symptoms? The answer is that this is hypothyroidism. Okay. And the causes are primary causes are atrophic thyroiditis and Hashimoto's thyroiditis, iodine deficiency, and drugs, for example, lithium propylthiouracil and iodides, etc., congenital agenesis, and inborn errors. The secondary causes are pituitary tumors and pituitary surgery or radiation. Now, the symptoms of hypothyroidism are cold intolerance, dry skin, constipation, menstrual abnormalities, horsewise, tiredness or weakness, weight gain, and despite poor appetite. The signs are dry, coarse skins, cold peripheries, myxedema, diffuse alopecia, loss of outer third of eyebrows, bradycardia, peripheral edema, and delayed tendon reflexes. Okay, so here we are having the coarse skin and the alopecia and the old looking skin. These are the signs of the thyroid. The investigations are serum T4, serum T3, and serum TSH. In hypothyroidism, TSH is raised and T3 and T4 will be decreased. Antithyroid peroxidase and antithyroglobulin antibodies, serum LDH and CK, serum cholesterol, serum sodium, and CBC. The management options for hypothyroidism are thyroxine replacement therapy and iodine. So, this is hypothyroidism, and these are the causes which are primary and secondary. In primary, we are having atrophic thyroiditis, Hashimoto's thyroiditis, iodine deficiency, drugs, for example, lithium propylthiouracil, congenital agenesis, and inborn errors. The secondary are pituitary tumors, pituitary surgery or radiation, and the symptoms are cold intolerance, dry skin, constipation, menstrual abnormalities, horsewise, tiredness and weakness, and weight gain. The signs are dry, coarse skin, cold peripheries, myxedema, diffuse alopecia, loss of outer third of eyebrows, bradycardia, peripheral edema, and delayed tendon reflexes. And these are the investigation options: serum T4, serum T3, and serum TSH. Okay, now this is the fourth case, which is exophthalmos. Observe the picture and identify the condition. So this is exophthalmos, that is also known as Graves' disease. Okay, and what are the investigation options and management? So for exophthalmos, T3, T4, and TSH will be done, and thyroid scan is done, and antithyroglobulin and antimicrosomal antibodies are checked. In Graves' disease is due to hyperthyroidism. Okay, so in this TSH will be decreased and T3 and T4 will be raised. So these are the investigations option. And for management of the hyperthyroidism or Graves' disease, methylcellulose eye drops are given. Lateral tarsorrhaphy can be done. Steroids, for example, prednisolone is used. Low dose radiations are used, and intravenous immunoglobulins are given. And orbital decompression is done for exophthalmos. Okay, tarsorrhaphy and orbital decompression, and methylcellulose eye drops. Now the fifth case is rheumatoid arthritis. The picture is given and what is the likely diagnosis, what are the findings in hand. So the diagnosis is rheumatoid arthritis. You can see in the hands, and the findings are ulnar deviation of the fingers, swan neck deformity, synovial swelling at the wrists, extended tendons, and MCP and PIP joints, Z deformity of the thumb, and buttoned or buttonhole deformity, dorsal subluxation of the ulnar styloid, and triggering of the fingers. These are the ulnar deviation of the fingers. This is the Z sign of the thumb. Here is the swelling of the wrist and carpal metacarpophalangeal joints, MCPs. And the investigation options that are done for rheumatoid arthritis are CBC and ESR, X-ray hands and wrist, and C-reactive protein, rheumatoid factors, X-ray knee, and joint fluid aspiration. The treatment options are physical rest and passive exercise, and SEDs are given. Disease-modifying anti-rheumatic drugs, for example, methotrexate and sulfasalazine are given, and surgery, for example, synovectomy, osteotomy, arthrodesis, and arthroplasties. The diagnostic criteria is that any four of the following is that morning stiffness for greater than 1 hour, arthritis of 3 or more joint areas, arthritis of hand joints, symmetrical arthritis, rheumatoid factors, and radiological changes, and the duration of 6 weeks or more. These are the diagnostic criteria for the rheumatoid arthritis. The radiological findings are that there will be decreased joint space, there will be symmetric involvement, there will be juxta-articular osteopenia, and there will be loss of articular cartilage and bone erosions, and there will be subluxation and ankylosis. Okay, so these are the signs and symptoms of rheumatoid arthritis. This is rheumatoid arthritis. What are the findings in hand and what findings are in picture? Rheumatoid arthritis, these are the findings, these are the investigations, these are the treatments, and these are the diagnostic criteria, radiological findings. Okay, this is our sixth case of this PDF, which is SLE. So observe the picture and give the likely diagnosis. Here we are having a butterfly rash, so it gives us SLE. The investigations, the criteria for diagnosis, and the management. So the diagnosis is that it is SLE. The investigations are the CBC, ASR, C-reactive protein, serum ANA, anti-D, anti-DNA, antiphospholipid antibodies, complements level, urine DR or UCE is done. The diagnostic criteria is that where there will be malar rash, discoid rash, photosensitivity, oral ulcers, non-erosive arthritis, pseudocystis, for example, pruritus or pericarditis, and renal disorders, for example, proteinuria, cellular casts, neurological disorders, for example, seizures and psychosis, hematological disorders, for example, anemia and leukopenia, thrombocytopenia, and autoimmune hemolytic anemia. Serum ANA is rest. Immunological disorders, for example, anti-DS-DNA, anti-Smith antibody, anti-phospholipid antibody. Okay. So these are the diagnostic criteria. This is very important. You should remember this. That in SLE, these are the things which are present. The management is NSAIDs are given. Glucocorticoids, for example, prednisolone is given. Chloroquine is given for skin lesions or arthralgia. Any immunosuppressant, for example, azathioprine and cyclophosphomides are given. And plasmapheresis is an anticoagulants, that is antiphospholipid syndrome. Anticoagulants are given for this syndrome. So this was about the SLE. This is the butterfly rash, and this is the diagnosis. These are the investigations. That is CBC, ESR, CRP, serum ANA, and anti-DS DNA, antiphospholipid antibodies, complement levels, urine DR or UC. And this is the diagnostic criteria. There is malar rash, discoid rash, photosensitivity, oral ulcers and non-erosive arthritis, serositis and pruritus, renal disorders, neurological disorders, hematological disorders, and serum ANA will be raised. These are the management options. That is NSAIDs, glucocorticoids, and prednisolone, and chloroquine will be present. Immunosuppressants, for example, azathioprine and cyclophosphamide and plasmapheresis. Now this is the next case, which is observe and identify the condition. So this is facial palsy. What are the causes, what are the clinical features, and how you will manage? This is the facial palsy. The causes are supranuclear, which is cerebrovascular accident, and within pons are pontine tumors and demyelination disorders and CVA. In CP angle acoustic neuroma, meningioma, secondary tumors, in petrous temporal Bell's palsy, Ramsay-Hunt syndrome, otitis media, and trauma. On face, there will be parotid gland tumors, sarcoidosis, mumps, and trauma. And the clinical features are impaired taste on anterior 2/3 of the tongue, unilateral facial weakness, dribbling of the saliva or water from the affected side, loss of wrinkling on affected half of the forehead, and flattened nasolabial folds, loss of retroaction of the angle of the mouth, and Bell's phenomena. Now the management options are medical, which is prednisolone, analgesia, acyclovir, and acyclovir. Okay, and okay, so this was about the facial palsy. The diagnosis is facial palsy. The causes are supranuclear and within the pons and in CP angle, in petrous temporal, and on face. So in the supranuclear are CVA, in pontine are tumors and demyelination disorders, in CP angle are meningiomas and secondary tumors, and petrous temporal are Bell's palsy, otitis media, and trauma, and on face are parotid gland tumors, sarcoidosis, mumps, and trauma. And these are the clinical features. There will be impaired taste, unilateral facial weakness, dribbling of the saliva, collection of food in the mouth on affected sides, loss of wrinkling on affected half of forehead, flattened nasolabial folds, and loss of retroaction of the angle of mouth, and Bell's phenomena. And the management is that medically prednisolone, analgesics, and acyclovir are given. Now this is the next case, which is myasthenia gravis. So what is shown in the picture? It is myasthenia gravis, and which drug is used for this test? So what is the diagnosis if this test comes positive, and which drug is used for this test? So the diagnosis is myasthenia gravis, and the identification is done through penicillin test. Okay, and the drug that is used is idrophonium. The diagnosis is myasthenia gravis, and the test through which this is identified is penicillin test, and the drug that is used is idrophonium, which is 2 mg intravenously. Okay. Management, investigation, and differential diagnosis. So the management is that oral anticholinesterase, for example, pyridostigmine, is given. Thymectomy is done. Immunosuppressant, for example, steroids, azathioprine, and cyclosporines are given. Plasmapheresis is done, and intravenous immunoglobulins are given for the myasthenia gravis. Intravenous immunoglobulins, plasmapheresis, immunosuppressant, for example, steroids, cyclosporines, and azathioprine, and oral anticholinesterase. Investigations that are done are CBC, UCE, and ESR, and serum egg receptor antibodies, and nerve stimulation studies. Chest or MRI for thymoma is done, and NA or RF factors. The differential diagnosis of the myasthenia gravis are hypothyroidism, botulism, Lambert-Eaton myasthenic syndrome, and intracranial mass lesions. Okay. So these are some important things. You can look at the picture. This is myasthenia gravis, and it is confirmed through penicillin test, and the drug that is used is idrophonium 2 mg intravenously, and oral anticholinesterase, pyridostigmine, thymectomy, and immunosuppressants, that is cyclosporins and azathioprine, plasmapheresis, and intravenous immunoglobulins are given for treatment. The investigations are CBC and urea creatine and electrolyte, and ESR, serum ACH receptor antibodies, nerve stimulation studies, chest X-ray, CT, and MRI, ANA, and RF factors. The differential diagnosis are hypothyroidism, botulism, and intracranial mass lesions. Okay, now coming towards the next case, that is gynecomastia.